Welcome to the deep dive. Today we're tackling a really interesting puzzle. How do you become a clinical coder if you have zero healthcare background?
It's definitely a challenge, but it's more about strategy than just luck. First step, realize coders aren't just admins, they're really the architects of healthcare data.
Architects of data, I like that. So it's not just typing numbers.
Not at all. The codes you assign, they directly impact if hospitals get paid. That's the revenue cycle backbone. And they also create that anonymous data for public health.
Ah, right. Like tracking diseases on a large scale.
Exactly. Think about COVID. Tracking its spread relied heavily on coders using those new ICD-10-CM codes correctly. A tiny mistake could mean no payment.
Or skewed national health data. That's a lot of pressure.
It really is. Big implications.
Okay, so if someone's coming from, say, accounting or IT, what skills actually carry over? What do you absolutely need?
The absolute must-have. Extreme attention to detail. I mean, really extreme. One wrong character can cause a claim denial, maybe even trigger an audit.
Wow. Okay, so precision is key. What else?
Strong analytical skills. It's like solving a puzzle, honestly. You're reading doctor's notes, which can be, well, complex, sometimes vague. You have to figure out the full picture.
That makes sense. Well, the big wall seems to be the medical stuff, right? The clinical knowledge.
That's the main hurdle, yeah. Acquiring what we call a functional clinical lens, you need three main things for that.
Okay, what are they?
First, medical terminology. You need the language. Understanding prefixes, roots, suffixes, like knowing epinectomy means removal, while episiotomy means cutting into. Big difference.
Right, so you hear distal phalanx of the hallux,
Yep.
and you instantly know tip of the big toe.
Exactly. Which leads to the second thing, anatomy and physiology, A&P. That gives you the where in the body.
Got it. Terminology, A and P. What's the third?
Pathophysiology, that's understanding how diseases work, how they progress. Like knowing chronic kidney disease is often linked to diabetes. That lets you connect conditions, find the right specific ICD code.
Okay, so that complexity explains why there's so many different coding systems, this alphabet soup people talk about.
Pretty much. The complexity matches the different needs of, say, a doctor's office versus a hospital. ICD-10-CM, that codes why the diagnoses, used everywhere.
And CPT codes, those are the procedures?
Right, CPT is for procedures, but mainly in outpatient settings, like your doctor's visit.
But if that same procedure happens inside a hospital?
Then you switch gears completely. You use ICD-10-PCS, totally different system, used only for inpatient hospital procedures.
So one patient visit could mean juggling ICD-10-CM, CPT, and ICD-10-PCS.
And probably HCPCS Level II as well, for things like drugs or medical supplies. Yes, it's common.
Which brings us to the big catch-22. Job postings want 1 to 3 years of experience, but how do you get that first job?
Right, the experience paradox. Employers are understandably cautious, the stakes are high, so you need a smart workaround.
Okay, lay it out for us. What's the strategy?
First, get certified. Your main choices are usually AAPC's CPC, which is more outpatient-focused, or a HEMA CCA, which is broader.
But the certification alone isn't experience. How do you bridge that gap?
Virtual practicums are key. Things like Practicode, they give you hands-on practice with real, redacted cases, documented experience.
And that can help with the apprentice status on the CPC.
Exactly. It can often satisfy the experience requirement faster, but the most practical approach.
Let me guess, start nearby.
You got it. Aim for a paid, entry-level, coding-adjacent role first. Think medical billing clerk, maybe a health information technician or records clerk.
Ah, so you learn the ropes, the context, the compliance stuff from the inside.
Precisely. You become a known quantity, someone the employer feels safer promoting into a full coding role later, less risk for them.
That makes a lot of sense. It sounds like a stable career path, too, with projected growth.
Yeah.
But the job itself is changing.
It is. It's evolving. The future likely sees coders more as high-level data quality auditors, validating AI-suggested codes, handling the really complex cases the tech can't.
So less pure data entry, more quality control and complex analysis.
Definitely. And that really doubles down on the ethical responsibilities.
Yeah.
IPA confidentiality is paramount, obviously, but it goes deeper.
How so?
You have a professional duty to resist any pressure to code incorrectly just to increase payment. Things like upcoding or unbundling services. That's illegal, and your integrity demands you refuse. Your loyalty is to accuracy.
Accuracy above all else. So here's the final thought then. Imagine an AI suggests a lucrative code, but the doctor's notes are just a bit ambiguous. How do you, the human auditor, make that call? Choosing integrity over